Welcome to our discussion today. We'll be dealing and talking about our immunity as it relates to our physical activity. In the past, we have talked about the effect of this SARS-CoV-2 effect on our body, on our health, and we identified only two ways out. One is to decrease our exposure, and the other one to increase our immunity. And so now we talked about how to increase our immunity. We said immunity can be increased by nutrition. We discussed that. Besides reducing the exposure through keeping the distance of 6 feet, washing the hands frequently, wearing a mask, and staying inside as much as possible, which causes some problems with the activity. Where are we going to be physically active now? Football fields are not to be used so much, but inside. So quality of human life depends partially on lifestyle, and lifestyle depends on kinds of habits that we develop over time. And the freedom is necessary so that we could enjoy the habits that we have developed. And really, we're not willing to change our habits. But what happened at the beginning of the year, you tell me. You see that we had to change our habits drastically. Why? Because for sake of survival, because of thousands of people's death, we had to find out frantically what to do to reduce the number of exposures, the number of cases, and the number of deaths. We see that social distancing is working. I hear that we have reached the plateau, and now we can start hoping that slowly the numbers are going to start going down, but this may take some time. This is more problematic because this virus is very infectious. It can be infective even before symptoms start. So it can be infective 3 days before you can notice that you're infected, and you can be distributing the infection to other people without even knowing that you're infected. That's how tricky this virus is. We have to boost our immunity, and we really have to understand, what our options are. So what does this virus, actually the name is SARS-CoV-2, creates actually the infection called COVID-19. What does it has to do with immunity? Well, we see that final response is either illness, death, or staying healthy. But we continue to celebrate, and we don't want to change our habits. And it took us a long time to understand how dangerous enemy we're dealing with that cost us hundreds and thousands of lives. So this SARS-CoV-2 comes out of a group of SARS viruses which have infected people at different times since 2005 at different places, even in Mediterranean area. And the difference between this infection and simple influenza flu is in the very vicious and specific attack of the virus on the lung tissue. So the pleural pneumocytes are affected in the way that this virus, when it comes into the cells, it destroys them. And when they are destroyed, they just get filled up with a serum liquid, and they cannot work for getting oxygen in your blood. And so what's happened now? We see that if this happens, it happens on a specific receptor site for the angiotensin converting enzyme receptor protein. That's where the virus gets in. And we can see what's happening. We have cellular immunity, that means protection through specialized lymphocytes and macrophages, which gobble up all the viruses. And on the other side, the humoral immunity, which means antigen-antibody responses. So in this situation, we see how the lung tissue can be destroyed, and there is no joking with that. And we'll see, what difference does it make, what happens. So we have two tests that I would like to mention here. One of them is simpler, just based on the detecting antibodies on the cell surface, indicating that there was a problem of attack of the virus, and the body has reacted by creating antibodies. And the other one is AC2 RNA. This is a RT-PCR reverse transcriptase, which indicates that the virus is actually in the cell. There is a possibility of reinfection, and also we don't know much about this virus. We just say it's novel. That means that nobody is immune to it. It is new, and we don't know where it's coming from, possibly from some lab. But the immunity is possibly short-lived, and therefore we don't know how careful we have to be, as careful as we can be. So the characteristics and the danger of this virus is especially because it focuses on these pneumocytes and destroys them. And the simple influenza flu doesn't use this. So here's a different level of danger that we are dealing with, and therefore we have to be very careful. That's why the schools are closed. That's why everything is closed. That's why we have the recommendation to stay in home as much as possible to prevent any possible unexpected contact with this virus, because we don't know what's going to happen. So how dangerous is this virus? Dangerous is depending on the level of your immunity. So if your immunity is perfect, great, then the symptoms, because you don't have any immunity, your body is going to respond in some way. It's going to be very mild, so mild symptoms. With moderately weak immunity, the symptoms may be stronger. But with poor immunity, the lung tissue is going to basically go into the breakdown. The inflammation is going to develop, and this can lead to a very rapid and deadly immunoresponse, which can lead to ARDS. Actually, I've experienced it myself in 2013, exactly this cascade. I had to be on a respirator for 3 weeks, and I'm thanking God for his intervention, because they gave me only 30% a chance of survival, and thanks God for helping me. So where is our immunity in the body? The cellular immunity is in our blood, in the lymphocytes and macrophages. A humoral immunity in the entire body and circulation. And also immunity plays a role in the pneumocytes, in the lung tissue, where the battle is. So now let's see, how can motion help us against such a dangerous enemy? Wellness. Activity is creating wellness. We know that activity is stimulating endorphin production to make us feel better. And actually, by moving, we experience ourselves as that we are able to do something. We have various activities that we do, which create all kinds of different kinds of pleasures, like music, playing something that we like to play, singing, just to mention some examples. So we see how the activity is connected with our well-being. And musical therapy is something that we all need. But not only that, but we need everything that is including physical activity. And we'll see why. Man is a mobile creature and feels happy only when he moves. If you tie him down that he cannot move, he's very unhappy and gets sick. Now we have different forms of motion around the house, in the field. I mentioned music, ballet, sculpturing, sport activities. All of that is happening through the motion of our body, and this through the individual muscle organs. Heart muscles of the entire body, but all is based on the circulation of individual organs. And the purpose of that is, you can guess now, because it is a liquid, and we have the red cells with the hemoglobin that carry oxygen. It binds oxygen very strongly through this gas exchange in the lungs, and brings the oxygen to all the organs, to all the cells, and primarily to brain. We used to say and feel it is important for us to exercise, to walk, and everything else. And we thought that it's good, to get all our body, all our muscles in motion, get strong muscles and all of that. But most times we don't think at all about the brain, and this is actually the number one reason and importance of getting the oxygen, because function of the brain is going to help us, thinking, concentration, planning, and activities, the fine coordination of movements. All of that is part of this circulation. So purpose of carrying oxygen and nutrients is going to go to the whole body. And oxygen makes complex functions of the organs and of the cells happening. Oxygen is necessary for the immune-linked cells of lymphocytes, macrophages, and other cells that are involved in the immune responses. So the better the circulation, the more oxygen we have, the better response of the tissues, but primarily also in the lungs, because this tissue is attacked primarily. So how is immunity improved? Through motion, by improved on the organ level, on the cellular level, and improving the function in the lungs. So more oxygen, better immunity. So when we move more, our life has more meaning, stimulates our circulation, and all aspects of humanity and immunity are increased through the oxygen, which comes through the motion. So here we see how motion is linked, and that really by increasing our physical activity, we can increase our immunity. But we need to think now how we can adapt to this special situation that we are now. We are not supposed to go outside of the house, so everything that has to happen with activity needs to be inside the house. So we need to design and plan and exercise in the room, on the chair, on the floor, doing the knee bends, push-ups, any other activities that will allow us to, for instance, create a standing on our, actually, when we lay down, and increase, stretch our arms, and then try to stay in this position for more than 10 seconds. You will see how you feel the muscles that are all involved there. So it is important to be creative now. You can include music, you can dance, to the music inside, play with your kids, get them all moving. There was an anecdotal recommendation by one physician in Belgrade who was recommending his patients to get out on the street there where it was not forbidden to go out on the street, because then the police would start running after them and they would run away from them, and that way they would get some activity and they would feel better, but only for a short time. So I would not recommend for you to do that. Thank you so much for your attention, and I wish you success in exercising regularly and seeing to be victorious over this virus. Thank you.